Virginia say they've seen a jump in mental health problems among students over the past decade. It's a trend that mirrors college campuses all over the country.
Tonight, Rachel Ryan talks with students at UVA dealing with their own mental health issues about what keeps so many of them from getting help and what they are doing to change that.
Anne Sophie Kimmerly is one of thousands of college students coping with a mental health issue.
People don't think that therapy is going to do a whole lot, but it does wonders. It really does.
As a third year at the University of Virginia, Kimmerly says it's taken her a long time to learn how to deal with her sometimes debilitating depression.
It kind of hits you like a truck, and you don't really know what to do. You feel lost, or you feel a little bit alone, and that's what we try to offer. We try to offer resources and people who understand and people who want to help.
She and about a dozen other students are members of the UVA chapter of Active Minds, a national organization focused on mental health on college campuses. It's a good place to start. 1 in 4 young adults between the ages of 18 and 24 have a diagnosable mental illness, and a survey of college counseling center directors shows 70% of them believe the number of students with severe psychological problems on their campus has increased in the past year.
There are more people coming here who need more mental health support, and in some cases, pretty intensive mental health support.
At UVA, a staff of counselors and psychologists offer services through the Student Health Center, but many students don't take advantage because of the stigma attached to mental health.
It does get in the way of a lot of students who could benefit from the really good counseling and psychiatric service that we provide here.
Members of Active Minds say an even bigger problem on grounds is the majority of students aren't aware of what's available to them to begin with.
So students actually have already paid for a lot of these resources, but they, whether they don't know that these resources exist or whether they're too scared to go, they a lot of times end up not utilizing them.
A group of students have brought the issue to the attention of legislators here at the State Capitol building, introducing their own bill that would require universities to provide more information about the services available to students.
House Bill 206 is a mental health awareness bill, which is aimed at the hope of making it so that people actually know about the resources available to them at universities across the state.
Patrick McDonnell is a member of the UVA Legislators of Tomorrow and helped draft the legislation.
Mental health is something that, that appeals to the common humanity of people on both sides of the aisle. Democrats and Republicans understand that we have a mental health crisis in this country and in this state. And I think that both sides, no matter how ideologically divided you are, can understand that we have to do something about it.
His classmates, members of Active Minds, agree it's a step in the right direction.
It's an important step and that we definitely need it because honestly, we don't have anything like that right now.
These students working together and with lawmakers to make things a little easier for the ones following in their footsteps. Rachel Ryan, CBS 19 News.
Moms in Central Virginia teaming up to help improve the mental health care system. Their actions spawned out of personal tragedy. Both of their sons diagnosed with serious mental illness.
Both women say they faced roadblock after roadblock in trying to get their sons help, and they don't want other families to have to go through the same thing. Rachel Ryan has their stories.
When Kathy Harkey's son Josh was discharged from the Navy, she says he came home a different person.
He wasn't talking as much, he wasn't socializing with friends, he wasn't caring for himself, he just wasn't involved.
The 20-year-old was diagnosed with schizophrenia.
My children are my world. That was my 100% focus. On the phone, researching at the library, online, going into doctor's offices, going into community services boards, begging for help.
Because her son was an adult, Harkey couldn't force him to get the treatment she knew he needed.
It's like walking into a brick wall sometimes trying to get treatment in Virginia.
As her son's mental illness worsened, Harkey's hands were tied. After 4 years of battling schizophrenia, Josh committed suicide.
He died January 8, 2006. He was 24.
After Josh's death, Harkey began working for the National Alliance on Mental Illness, lobbying lawmakers in Richmond to improve the way the state takes care of its mentally ill and removing roadblocks for families trying to seek treatment for loved ones.
After I lost him, I knew that things had to change.
Right now, Virginia laws only allow hospitals to hold patients suffering a mental crisis for 6 hours. After that, they're free to go. Lawmakers are considering extending that time frame to up to 24 hours, providing more time for doctors and family members to make sure people get the care they need.
We're under very tight time constraints to make a decision about really somebody's future, but their immediate care. And they're tighter in this state. We have less time to complete an evaluation in Virginia than almost any other state in the nation.
Dr. Syverud also serves on the state's mental health task force and says this is just the tip of the iceberg when it comes to improving care.
That intervention earlier, when family members first recognize it, is a lot more effective, both short-term and long-term. But unfortunately, the only time you can force someone right now to get care is when they get to that very end stage.
People say, well, why didn't the family do anything? I can assure you 100% the families desperately try to do everything they can.
It's a battle Harkey knows all too well, and one Maria Carlton is beginning to understand.
I go to all the authorities and all the services only to be told that he's not sick enough or not threatening enough to be able to do something. And yet, I know my child better than anyone. I know this is not him. This is scary.
Carlton's 25-year-old son Aaron suffered a psychotic break at work 2 years ago.
Told his coworkers that he was hearing voices and that he was seeing, things talking to them, and that he heard voices coming out of his stomach.
Aaron was diagnosed with bipolar disorder, but he continues to refuse treatment and has been in and out of the emergency room.
I actually sneak medication in his meals. Without it, I know that, he would be totally derailed.
Carlton worries her son will share the same tragic fate as Harkey's son, Josh. The two women are teaming up to tell their stories and pressuring lawmakers to change the way care is provided to the mentally ill, focusing on more preventative care and better follow-up for people with severe mental illness.
The very first time he was diagnosed, there was nothing. He was discharged, and his first appointment was a month and a half after being told that his life would change forever.
A person with a mental illness needs to have a treatment plan, medication, cognitive behavioral therapies. They need a treatment plan, coping skills that is going to work for them, and you can't put that into place with a one-night stay in a hospital.
Two moms on a mission to save other families from similar heartbreak. Rachel Ryan, CBS 19 News.
In the final part of our series on the mental health system, we'll show you a place called the Wellness Recovery Center in Albemarle County.
It's a safe place for people to turn when they're suffering a mental health crisis, and patients of the program say it works. Rachel Ryan has their stories.
There's good days, there's bad days. There's days where I have thoughts running through my head that I shouldn't have.
Chris Hall has lived with his bipolar disorder for nearly 20 years. We met Chris at the Wellness Recovery Center,
I'd recommend this.
where he's just finishing up a 2-week stay.
Yeah, I've dealt with my disease for so long. I mean, that's what I consider my mental illness. It's a disease. I can tell when I'm getting stressed out and the medications aren't working. I either get in contact with my emergency services person, and, I tell them, can you see if Wellness Recovery has a bed?
The Wellness Recovery Center offers people suffering from a mental health crisis a safe place to stay and get back on track. It's a rare middle ground between a bed at a psychiatric hospital and being out on the streets and on their own. It's a new concept to care, and it's gaining traction in the mental health care community.
I'd really like to see it throughout the state. Right now there are only a very limited number of crisis stabilization programs. I think there probably should be one within an hour of where every person in the state lives.
I got to work on myself.
Rachel All was referred to the wellness program in Albemarle County after she began to sink into a deep depression and have suicidal thoughts.
Examining your thought process.
She takes part in the daily group counseling sessions, focusing on self-esteem and relationship building.
I love the way that it's set up. It really helps with different parts of you that need healing.
With a staff of 35 doctors, nurses, therapists, and specialists on hand, visitors like Rachel and Chris can stay anywhere from 1 day to 2 weeks. The facility boasts a community kitchen, an activity room, and all the individualized support a person needs to get back on track.
I think we have it. I think we have it figured out, and I think we have a program that actually works.
Chris is just finishing his 2-week stay and says he's very nervous about going home because he knows as much as the program offers him skills to cope with his disease, it doesn't offer a cure.
Sometimes I wish I could just press a button and say I don't need these meds, but the thing is, I've tried that before. I have to stay on my meds or I get worse off than I am. And I just do the best I can.
The Wellness Recovery Center has 14 beds, and they're usually full with patients. If you'd like more information about the program, just head to our web channel at newsplex.com. Reporting in the Newsplex, Rachel Ryan, CBS 19 News.